Hi there, and welcome back to Soton Brain Hub. My name is Calvin, and today we'll be talking about meningiomas. A meningioma is a type of tumour that arises from the meninges. These are the membranes that surround the brain and spinal cord. There are three of these layers: the tough outer layer called the dura mater, a middle web-like structure filled with cerebrospinal fluid that protects the brain called the arachnoid mater, and the innermost delicate layer called the pia mater. Meningiomas are the most common tumour of the meninges and the most common type of tumour that forms in the head. Meningiomas can grow anywhere in the brain and spinal cord, but they are much more commonly found in the meninges surrounding the brain. They typically grow from the middle layer of the meninges, the arachnoid mater, and are often round, well-defined growths that are homogeneous in nature. This just means that the growth contains cells that are all the same type. The term extraaxial is used to explain that meningiomas exist outside of or are external to the brain itself. Most meningiomas are benign, meaning that they will grow larger over time, but are unlikely to spread. Meningiomas can be placed into groups depending on how quickly they are likely to grow. This is called the grade, and it describes how abnormal the cells look under a microscope. Meningiomas can be graded as 1, 2, or 3. Grade 1 meningiomas are the most common type and are referred to as low grade. These tumours are slow growing and benign. If all of the tumour is removed, they do not usually come back after treatment. Grade 2 meningiomas are sometimes called atypical tumours. They grow more quickly than grade 1 meningiomas, and they may be more likely to come back after treatment. Grade 3 meningiomas are also called high-grade tumours, and these are malignant. They usually grow more quickly and are also more likely to come back after treatment. As we've discussed, most meningiomas grow very slowly and remain undetected for a long time. This means that the signs and symptoms of a meningioma typically begin gradually and may be very subtle at first. Depending on where the tumour is situated, they may compress or squeeze the adjacent brain, nerves, and blood vessels. Signs and symptoms may include changes in vision, such as seeing double or blurriness, headaches, especially those that are worse in the morning, hearing or memory loss, loss of smell, seizures, weakness in the arms or legs, and language difficulties. It is important to mention that some meningiomas do not cause any symptoms at all, and instead may be picked up as an incidental finding. The most common tests to diagnose a meningioma include an MRI or CT scan. Blood tests and a scan to look at the blood vessels in the brain, called an angiogram, can also be used. There are a few different treatment options available. For a low-grade meningioma, active monitoring approaches, sometimes referred to as watch and wait, may be taken. Here, patients will receive regular scans to monitor the size of the growth. Treatment may then be initiated if there are signs that the meningioma is growing. However, in some patients, the tumour grows so slowly that treatment is never needed. If treatment is required, then the most likely approach would be surgical resection to remove the tumour, and often this is the only treatment that is needed. Additionally, radiotherapy, especially a special type called stereotactic radiotherapy, may be used to help destroy tumour cells. This can be after surgery if the tumour cannot be completely removed, after surgery for high-grade meningiomas to reduce the chance of it coming back, or as the main treatment if surgery is not possible. Meningiomas do not respond well to chemotherapy, so it is very rarely used. The location of the tumour is the most important factor in determining the outcome for the patient after treatment, as some are much easier to remove than others. The patient's age and overall health prior to surgery may also affect their results. Meningiomas do sometimes recur after surgery or radiotherapy. As such, regular follow-up MRI or CT scans every 1 to 3 years are an important part of long-term care for anyone diagnosed with a meningioma. Thank you for watching this video. Remember to like if you enjoyed it, and subscribe to the channel for more videos like this and others related to the anatomy of the head, neck and brain.
Find us on Facebook, Instagram, and subscribe to our YouTube channel to help explain the mysteries of the brain.